There are different types of diseases that affect humans and other organisms. We're going to focus on diseases that affect humans and explore the different types. So, a disease is an abnormal condition affecting the body of an organism. So, it changes the homeostasis of your body and affects your body in ways that affect the functions to not be as efficient. There are non infectious and infectious diseases. Non infectious diseases are diseases that are caused by genetics or environmental factors. These are not contagious, meaning that they cannot be spread from person to person. Infectious diseases are diseases that are caused by pathogens, and we're going to talk about what a pathogen is later. But these are contagious and can be spread. These are the ones that you can get from somebody else. Non-infectious diseases, again, are diseases caused by genetics or environmental factors. So these are diseases that either you're born with or a person is born with in their DNA, in your information, or the environment has affected parts of your body in ways and possibly damaged tissues or changed tissues to cause some sort of abnormality in the body. Examples of non-infectious diseases are diabetes, color blindness, Down syndrome, sickle cell anemia, heart disease, scurvy, cystic fibrosis, osteoporosis, and any type of cancer. This is a short list. There are many others that are not included in this list, but these are some common ones that you may have heard of. Again, the causes of these are from genetics, so again, you're born with it, or some type of environmental factor that causes your body to not function as well. So, a poor diet, pollution, unhealthy lifestyle, so lack of exercise, or drugs and smoking, alcohol, something that could damage the tissue in your body. The other side of this are infectious diseases. So these are diseases that are caused by pathogens. Again, we'll talk about what those are in a little bit. But these are diseases that you can catch from somebody else. These are spread from person to person or spread through other means, and you will get it from your environment in some way. So examples of this are these are influenza or the flu, common cold, HIV, chicken pox, ear infections, any type of infection actually, strep throat, meningitis, pneumonia, whooping cough, syphilis, athlete's foot, ringworm, yeast infections, malaria. These are all different types of examples of diseases that you can catch. And these are caused by pathogens, which include viruses, bacteria, fungi, or parasites. So, what do you do about diseases? How do you protect your body? What do you do if you catch a disease? There are three different steps that you could take depending on how the disease has affected you, if it has affected you yet. So, what course of action is appropriate? Prevention methods. When you hear about prevention methods happening, these are things that you do to avoid getting sick. So, this happens before you're affected by the disease. Prevention methods are very dependent upon the type of disease, but these are things like vaccines, exercise, a healthy diet, washing your hands really well, getting enough sleep, boiling water, which we'll talk about why that's important in depending on the pathogen. But these are things that you do so that whatever causes you to get sick doesn't affect you. It stops the pathogen from entering your body. If you already get sick, so once you're sick and you don't feel well, you are going to go and do some type of treatment method. So these are things that you do to remove the symptoms or lessen the symptoms, remove the pathogen from your body, remove the diseased tissue. But these are things that you do to make you feel better. Um, these are used while you're affected by the disease. So once you already have the symptoms, you start to treat it. Examples include cough or cold medicine, steam rooms, surgery, radiation, chemotherapy, antibiotics. These are things that you do, and they're a little bit harsher in terms of how they're affecting your body than the prevention methods. And then if you most diseases are curable, or some are curable. And so if you are able to cure the disease, this is basically means that you completely remove the pathogen or disease tissue from your body. Um, Cures can also be a treatment method, and the treatment method can just be removing it. For example, surgery or antibiotics will remove the disease from your body. Um, but some don't have cures, and we're going to talk about why that is. So I've used this word pathogen. What is a pathogen? A pathogen is something, an agent that causes disease. Examples include microorganisms and viruses. So pathogens are what causes infectious diseases. So these are what causes you to catch a disease. You catch a pathogen. And a microorganism is an organism that's so small that it can only be seen with a microscope. It's also living, an organism. So it's basically micro means small, organism means living, so it's a small organism. Viruses, we're going to learn, are not living, so they don't fall under this microorganism category, but they are also a pathogen, an agent that will cause disease. All microorganisms do not cause disease. We looked at protists under the microscope. They don't cause disease. The ones we looked at don't, but they were a microorganism. So keep that in mind. Just because it's a microorganism doesn't mean it's also a pathogen. And also, because it's a pathogen doesn't mean it's a microorganism. We're going to look at some examples. But a pathogen is something that causes disease. Viruses. Examples include viruses, bacteria, fungi, and parasites. So we're going to go through each of these. So viruses are non-living microscopic molecules that rely on their host to reproduce. To prevent yourself from a viral disease, you want to get vaccines if they're available for your virus, get enough sleep, eat healthy, have really healthy eating habits, and wash your hands really well, along with other just general healthy practices. If you do get sick from a virus, the best things you can do for yourself is get enough sleep, continue to eat healthy, get enough fluids, wash your hands. Cough and cold medicines will make you feel better. But these will only reduce the symptoms of the disease. They won't actually remove it from your body. Viruses have no cures, meaning that your body will fight it off and kill it on its own, but it takes time. 7 to 10 days usually to remove this from your body. Examples of viral diseases include polio, smallpox, diphtheria, influenza, AIDS, mono, and the common cold. Bacteria are microscopic prokaryotic organisms that are found everywhere. However, not all bacteria cause disease. You have some really good, healthy bacteria that in your body that help you, your stomach function well, your intestines function well, but the bacteria that do cause disease can be very dangerous. To prevent from bacterial diseases, some have vaccines. You also want to get enough sleep, eat healthy, wash your hands, general healthy habits. If you do get sick from bacteria, you want to get enough sleep. Again, healthy eating habits, get enough fluids, wash your hands. And bacteria can also have antibiotics, which will stop the growth and reproduction of living things. So specifically, antibacterials will help with bacterial diseases. Cures include, again, antibacterials. They'll actually go in and kill the bacteria and not allow it to continue to reproduce. Examples of bacterial diseases that you may have heard of include tuberculosis, cholera, bacterial meningitis, strep, staph infections. Pretty much any infection is going to be caused by bacteria. Most, not all, most. Whooping cough, urinary tract infections, some stomach flus are bacteria as well. Fungi are another type of pathogen. They're both unicellular and multicellular eukaryotic organisms that absorb nutrients from their environment. Usually the fungi that will cause disease are microscopic. Some fungi that don't cause disease would be like mushrooms, and we eat those. Those are multicellular, but many that cause disease are microscopic microorganisms. Prevention methods are a little bit different. Fungi tend to attack your skin and the outsides of your body, and so not sharing hairbrushes, wearing shoes in public places, giving your feet and other parts of your body time to breathe, keeping everything clean. General good hygiene is helpful in preventing fungal diseases. Treatments include antifungal creams and shampoos, these are types of antibiotics. Keeping the skin clean and dry will stop the fungi from having a food source on your skin, as gross as that sounds, and allow them to not be able to grow. These are usually very easy to treat because they rarely spread below the skin. So we can see them, we can put the antibiotics right on the fungus itself and take care of it. Cures include antifungals, which will kill the fungi that are affecting you. Examples that you may have heard of, athlete's foot, ringworm, candida is a type of fungi that causes things like diaper rash and yeast infections, thrush. And then lastly, parasites are pathogens that are both unicellular and multicellular eukaryotic organisms that absorb nutrients from the body of another organism, often causing it harm. Parasite usually is something that's very harmful. That's kind of based on the definition. They cause disease. The ones that cause disease are generally microscopic, but some are not, such as tapeworms. You can see those. Prevention methods include hand washing, cooking meat thoroughly, washing fruits and vegetables, boiling water, not sharing hairbrushes, vaccines for some, and wearing bug spray just to avoid any bugs transmitting parasites or bacteria even. Treatment methods include antibiotics specific to each parasite. This category is big enough where the parasites are very specific. We need very specific types of antibiotics to affect them. Washing your hands well, just parasites live in dirt and soil and everywhere, and so just keeping your hands clean before you eat or putting your hands in your eyes will help keep parasites out of your body. Cures are antibiotics, again, specific to each parasite. And examples that you may have heard of, malaria, African sleeping sickness, pinworms, lice. Giardias is something that's found in lake water. That's why we boil our water. Tapeworms, heartworms in pets, if we're going to go beyond the human. All are things that are caused by parasites. So again, when we look at these diseases, we have two types of diseases. We have non-infectious and infectious diseases. Non-infectious diseases are genetic or are caused by genetic or environmental factors that are not passed from person to person, not contagious. Infectious diseases are passed from person to person or can be and are caused by pathogens, which are bacteria, virus, fungi, and parasites.